you want to e-consult a dermatologist about a skin lesion of concern, you now have the ability to send magnified images taken with a dermatoscope. A dermatoscope improves the diagnostic accuracy for many types of lesions, particularly for melanoma. It has been shown that in comparison to clinical examination alone, the use of a dermatoscope improves the sensitivity and specificity from 71 and 81% respectively up to 90%. As you probably know, the current wait time to see a dermatologist in Lancaster County is 3 to 4 months. E-consults to dermatology can significantly shorten the time to diagnosis and treatment for your patients. These consults are answered within 24 hours. Patients with potentially serious lesions receive expedited care from the consulting dermatologist, guaranteed to be within 2 weeks. Payment for e-consults with dermoscopy is the same as the standard e-consult to dermatology. This service is not currently paid for by insurance, and the cost of the service is $40. Patients should provide their consent for the payment prior to participating in the e-consult. Payment is due at the checkout on the day of service. Completing an e-consult with dermoscopy is simple, and all it takes is an iPhone and a dermatoscope. Let me show you how it's done. You will use your iPhone 8 downtime phone equipped with a special case that attaches to the dermatoscope. Start with the dermatoscope unattached. You will launch the Haiku app that's already loaded on the phone. Navigate to your schedule and select your patient. Tap on the patient's picture and select Capture Clinical Media. Now you're ready to take the first photo. Identify the lesion with a finger or a pen so the dermatologist can be certain which lesion you are referring to. Take a photo that captures the anatomic location so this same lesion can be readily identified in the future if needed. If you are satisfied with the image, select Use Photo. Type a description for the image, such as left forearm. Let's talk about the dermatoscope. You will be provided with a Dermlight DL200 hybrid, which can be used with the naked eye, or in this case, attached to an iPhone. Turn on the dermatoscope by pressing the button on the left. The scope is equipped with both polarized and non-polarized light. To switch between modes, press the button on the right side of the device. When the scope is in polarized mode, the light next to the P will be illuminated. When in the non-polarized mode, the light next to the P will be off. We are able to see different features of skin lesions using the different types of light, so it is helpful to view the skin lesion in both of these modes. The LEDs will shine on the patient's skin, and the image is viewed from the reverse side. Next, we will attach the dermatoscope and take the dermoscopic images. To attach the DL200, simply bring the back of the viewing lens up to the magnetic ring on the iPhone case, and it will snap into place. Make sure it is firmly attached and centered. You should not be able to slide the dermatoscope from side to side. Turn the dial located around the viewing lens to extend the spacer. The spacer and faceplate should be sterilized between every use. In Haiku, select Add Media to activate the camera for the next photo. To take a photo of the lesion using polarized light, set the scope in polarized mode and place the faceplate on the patient's dry skin. Center the lesion on the iPhone screen. Using your fingers on the iPhone screen, zoom in to the maximum magnification. If the lesion is too large to fit on the screen, zoom in just enough to fit the lesion on the screen with a small amount of space on the sides. Adjust the distance of the spacer so that the image is in focus and take the photo. If you are satisfied with the image, select Use Photo, then type a description such as left forearm polarized. In Haiku, again select Add Media to activate the camera for the non-polarized photo. Switch the dermatoscope to the non-polarized mode. The light next to the P should now be off. Taking a photo with non-polarized light requires the use of an immersion liquid. Mineral oil or alcohol-based hand sanitizer work well. Place a drop on the lesion, then place the faceplate on the liquid and the patient's skin, and magnify and focus as needed. Take the photo. If you are satisfied with the image, select Use Photo, then type a description such as left forearm, non-polarized. You can now select Save and all of your photos will be uploaded. For your final steps, insert and label your scout photo, your polarized photo, and your non-polarized photo into your note. If you haven't already, complete the e-consult Dermatology with Dermoscopy. Submit and complete. Here are some tips for obtaining high-quality images that you or a colleague will be able to interpret. Ensure the image is sufficiently magnified on the phone. The image should appear as large as it would if viewed through the dermatoscope with the naked eye. Zooming in to the maximum zoom on the iPhone gives the best image size. If the lesion is very large, zoom so that the lesion almost touches the edges of the screen. If the lesion is significantly larger than 6 millimeters, you will need to take multiple photos to capture the entire lesion at adequate magnification. We recommend dividing the lesion into quadrants and labeling the photos as appropriate, such as superior lateral, inferior medial, etc. If the lesion is still too large for this method, try to capture representative areas, as well as a non-dermoscopic close-up. In this case, the dermatologist may have to provide you with less certain feedback. The image should be in focus. The value of dermoscopy is in the fine details we can see with the magnified image, such as lacy reticular patterns called network and blood vessels. If these features are blurred, it is not a good image. That's it. It takes less than 15 minutes, and you'll have ensured your patient receives an accurate diagnosis and gets expedited care from a consulting dermatologist.